everyone, this is Winnie and welcome back to my channel. Please be sure to like, subscribe, and share this video with your friends and colleagues. We are going to have our first official video with questions and I am so very excited. The purpose of this channel, PSW Exam Preparation with Winnie, is to help you to pass the NACC exam. I have had so many students tell me about how challenging this exam is. So my hope is that I can guide you through it by giving you some questions and offering rationales. The best approach for you would be to look over the questions that I am providing, try to answer them first, and then I will provide the rationale. Another strategy is to read the question at least 3 times and try to answer it. And then, in that way, you will know that you have understanding of the question. Don't rush through the exam, guys, because it's very easy to fail if you do that. So let's begin. The first question is, what are support workers? A, licensed healthcare workers. B, unregulated healthcare professionals. C, all PSWs who pass the NACC exam belong to a professional college in Ontario. Or D, PSWs belong to a regulatory body. Try to answer this question. The correct answer is B, unregulated healthcare professionals. If you remember, when you were in class, you learned about UCPs, which means unregulated care professional. As a PSW, you are certified. What this means is, after you pass your NACC exam, you will get a certificate. But you are unregulated. You do not have a license. Positions with licenses include nursing, social work, occupational therapists, physical therapists, speech and language pathologists, dietitians, the list goes on. But as a PSW, you do not have a license. Licensed professions often require an annual fee or a yearly fee. You do not have to pay this. There is no professional college for PSWs. Next question. Mr. Beulah has been informed that he is palliative. He is very upset and worried. As a PSW, you understand that A, he will pass away in the next few days to weeks. B, he has a terminal illness, but he can live for many years if he takes the correct medication. C, he will be transferred to a hospice. Or D, he may continue to receive treatment for his condition. The correct answer is D. He may continue to receive treatment for his condition. Palliative care is comfort care. It focuses on pain and symptom management for a terminal disease. So what's a terminal disease? This is something that is life-threatening and there's no expectation of recovery. An example is stage 4 colon cancer. By this point, it's maybe spread to so many organs. So what they do is just provide pain and symptom management because they know that they cannot cure it. So this is more comfort than curative care. To cure something means you can get rid of it, if that makes sense, that you can heal it. But this is not the case for palliative. So nurses always have a scale that they use to determine how far a person is palliative. And if you remember learning about it, it's called a PPS score. This is the Palliative Performance Scale. So the scale ranges from 100 to 0. I know it probably is confusing, but 100 is at the top and 0 means death. So you start at 100 and work your way down. This is how you can also know if someone is needing hospice care. What is hospice? Hospice is end of life. Hospice means someone will pass away within a few days. So for somebody to be transferred from a palliative caseload to a hospice caseload, it means that there has been a decline in the health status. It also means that when someone is on hospice, The illness has advanced and death is imminent. Number 3. You and Mrs. Stein are talking about her recent surgery. You have been her PSW for many years, and you have developed a rapport. Which of the following is a closed-ended question? Do you feel better now? What are your plans after surgery? How was your hospital stay? So, the correct answer is, do you feel better now? A closed-ended question always has a yes or a no. An open-ended question allows an individual to give a free-form answer where you can really talk about everything. So an open-ended question is, for example, what did you do this weekend? Oh, I went to the park, and then I went to the beach, and then I saw the birds. That is an open-ended question. I could talk for 5 minutes with an open-ended question. A closed-ended question is something that just allows you to say either yes or no. So in this particular example, A is the right answer. Next question. You have been Mr. Lee's personal caregiver for the last 3 years. He states that he will provide you with access to his retirement savings account to review and assist him, and that you will get a portion for your help. You agree to help. This is a sign of A, financial abuse, B, financial literacy, C, this is fine because he knows you're in school to become a banker, or D, emotional abuse. This is definitely financial abuse, and the answer is A. As a PSW, you do not assist with finances. This is not in your scope. This is an example of an IADL. Do you remember when we spoke about ADLs and IADLs? ADL means activity of daily living. This is what you're responsible for: bathing, grooming, feeding. IADL is things such as finances. This is not in your role. Financial management falls under that, IADLs, and if a patient cannot manage them, then there's always another executor or a family member or another designate that takes over. So if you start to dabble with anybody's finances, this is definitely a good example of financial abuse. You are a PSW at a retirement home. You notice that a doctor is inappropriately pushing a patient without their consent. This is also called A, battery, B, assault, C, neglect, D, false imprisonment. The correct answer is battery. Battery is harmful. This is offensive touching of another person. It's intentionally causing physical harm to someone. Assault could be a threat. For example, I will hit you, Mr. Smith. I will attack you if you do not listen to me because I am trying to change you. That's assault, because you're giving warning. It's still not good, but that is what assault means. So you're provoking that fear before you hurt them. As soon as you touch them, it's now counted as battery. If a nursing home attendant surprises someone from behind, that also counts as battery. Neglect is when you leave a patient, where you don't truly care for them, where you leave them alone. A good example of neglect that I always think about is if you are working, for example, a first shift, and then you leave a patient in the bathroom. The patient doesn't know how to access the call bell because they have cognitive decline or maybe some dementia, and you leave them and you forget to take them from the toilet seat. When the next shift comes, they see the same patient sitting there. Maybe you put the patient at 2 p.m. and it's now 3:30 p.m. That is neglect. False imprisonment is when you put someone in a room, close all doors, they cannot leave that area. they feel imprisoned and confined in a certain area. So the correct answer for this one, because the doctor inappropriately pushed the patient, is battery, which is A. Next question. You are to feed Mrs. Adonai this morning. She had a stroke a few months ago. She's able to use her right arm, but you have decided to feed her because she's very slow. What principle are you not upholding? Non-maleficence. Autonomy. C. Justice. D. Beneficence. It's very important for you to remember these words and what they mean. The correct answer is B. Autonomy. Autonomy is the ability of an individual to make their own decisions. If you say, oh, Mrs. Adonai is really slow today, I have a very, very heavy shift, I need to go home because I need to do this, this, and that, you are not upholding her autonomy. You should always remember that in your position as a PSW, you're always trying to maximize independence to the ability of the patient, client, or resident. So you always want to uphold that. Non-maleficence is do no harm. Justice is about fairness. Beneficence is to act for the benefit of the patient. So by you feeding her, you're not upholding her independence. And this is important to always uphold in every patient that you are working with. Next question. What is the primary reason an unconscious patient is placed in the side-lying position when mouth care is provided? A. To make the oral cavity easily accessible. B. To prevent possible musculoskeletal injury. C. To reduce the risk of aspiration. Or D. To reduce plaque buildup in the mouth. The correct answer is C. To reduce the risk of aspiration. By reading this question 3 times over, you will have noted that they said unconscious patient. An unconscious patient is a patient who maybe is on life support, but they cannot speak for themselves. They are not aware of how to swallow. They are probably, or should I say definitely, getting tube feedings. So why put them in this position? You put them in that position because they're at risk of getting fluid in their lungs. By putting them in a side-lying position, this allows the prevention of aspiration. This prevents the pooling of secretions or anything at the back of the oral cavity. So as a result, the person will not aspirate. If it was a conscious patient, however, you would just make sure that you keep them upright. That's the difference. And you need to know the difference between oral care for an unconscious patient and oral care for a conscious patient. Next question. When undressing a client who has had a stroke, which side should you remove clothing from first? A, the strong side. B, the weak side. C, either side. B, both sides at the same time. The correct answer for this is A, the strong side. But one thing I want you to look at is if you look at C and D, they are kind of the same answer. Either side, both sides, So you would eliminate these automatically. I can understand, however, why people would be confused and think it's the weak side. So if you think of someone who had a stroke, the weak side is a side that's not working like it did before. So what you're doing is you're undressing the client who had the stroke. So you want to make sure that that weak or paralyzed side is taken care of. So you remove clothing from the strong side first. And the rationale for that is Once you remove it from the strong side will then help take it off from the weak side. What this means is the patient can help you in the process. So this also allows clothing to slide off easily off that weak arm without a lot of motion. When you're dressing, however, it is the opposite. When you dress a patient with a stroke, you start with the weak side first because the strong side can help that dressing to get on. So always remember this. If this is a confusing concept, I encourage you to watch a lot of videos on YouTube just to understand why this goes this way. But it's very important for you to know if you're using the strong side first or the weak side first. Next question. You are giving Mr. Frank a bath. This is a bed bath. As you were cleaning his perineal area, he gets an erection. What is the correct response? A. Oh my, looks like something is going on down there. B. I need more towels. Please give me a moment. I will be right back. C. Call another PSW to see what is happening. D. Tell the roommate about what is happening. The correct answer is A. I need more towels, so please give me a moment and I will be right back. Bathing and grooming is so personal, and you need to understand that having an erection is a normal reaction. It doesn't mean anything sexual or inappropriate. It's normal. So the right thing to do would be to go ask for more towels and tell him you'll be right back. This saves the patient from embarrassment. And honestly, you could have 10 towels at the bedside, but you still want to make sure that he's not embarrassed. Give him a moment. When bathing a male patient, this can occur. So just assess the response. You can see. If you've built rapport with this patient, it may be different, but this is always the right approach to just leave them for a bit and then come back. But please, don't tell the roommates and don't tell your colleagues that this happened. That is an invasion of privacy, and it's not appropriate. Next question. Mr. Peary needs rehabilitation after his left side is paralyzed after a stroke. Personal care is A. Supervised by a nurse. B. Postponed until he can use his left side. C. Done only by you to conserve his energy. D. Done by him to the extent possible. So this is another stroke question. The right answer is D. Done by him to the extent possible. If you remember in a previous question, we discussed that you always want to ensure that you maximize independence. So yes, it's your duty to provide personal care, but you don't want to do all of it. See how much a patient can do and then you do the rest of it. But it's in your scope. You don't have to wait for a nurse. You don't have to wait for a doctor. You don't have to do all that. You know it's in your scope of practice, so you can proceed, but just ensure that the patient does what they can. Okay, next question. You are documenting the output for Mrs. Smith. What would you document? You have 50 cc from emesis, 700 cc of juice she had for breakfast, 800 cc in her catheter bag, 100 cc of coffee, 50 cc from wound drainage. So I will give you a moment to look over this and try to answer the right question, or get the right answer. A is 900, B is 1700, C is 800, and D is 850. The correct answer for this is 900. If you do not know the difference between input and output, you will not get this question right unless you guess appropriately, but you have to know the difference. Input is what I put into my body. Output is what comes out. So if I get an IV infusion for hydration, for example, that's going into my body and that's input. When I use the washroom, I'm urinating, diarrhea, whatever the case may be, that's output. So from this, emesis means what they threw up. That's output. The catheter bag demonstrates the urine. That's output. The wound drainage shows what came out of the wound. That's output. So emesis is the same as what you vomit. Everything else is input. The juice she had went into her body. That's input. The coffee she had went into her body. That's input. So in this case, you would add the 50 from emesis, the 800 from the catheter bag, and the 50 from the drainage. 800 plus 50 plus 50 makes 900. And that is why that is the correct answer. Number 20, next one. The following statements describes delirium. Which is false? A, it is a temporary state of confusion. B, it is often a reaction to medication or infection. C, it should be ignored as it is a natural part of aging. D, it is an emergency. The correct answer is C. If you look at this, they said, which is false. It is always important for you to read questions over so that you do not choose the wrong answer. So they said which is false, or which is untrue, or which is not true. So C, it should be ignored. Delirium is not a common reaction to aging. In fact, it is an emergency. It is a temporary state of confusion, and it could be a reaction to medication or infection. It has to be addressed immediately. It's sudden, it's temporary. It is a medical emergency that needs prompt intervention. If you do not address the delirium right away, it leads to prolonged hospital stay, functional decline, cognitive decline, and eventually death. This is an emergency. So that's why C is the right answer. Which of the following is false? People with substance dependence disorder, A, experience withdrawal when they stop taking the medication or the substance. B, are at risk of dying from infections from contaminated needles. C, must take the substance to feel good and avoid discomfort. D, have only themselves to blame. So this is just like the previous question, where we looked at the word false. If you did not read the question properly, you can miss that. So it's very important to read it. So in this case, the correct answer is D, have only themselves to blame. You need to understand that there are many reasons why a person may have a substance dependence disorder. It's progressive, people lose control, and even though they may want to quit or stop using the substance or see that there is a consequence to me taking these drugs or taking this alcohol or taking all this, they cannot because their body has adjusted to consuming the substance. It can be life-threatening. Addictions are not concerns where you say this person is not moral. This person has no willpower. This person is terrible. It's very, very important to be non-judgmental when you are working with a patient with a substance dependence disorder. Addiction is so powerful. It's complex. People with this disorder cannot just quit. They can try, but they might fall right back into it. The drugs change the brain in a way that makes it so difficult physically and mentally. So when you treat an addiction, it requires lifelong care and therapy. But one thing you cannot do is blame a person for having a substance dependence disorder. So that's why that is the right answer. Now we get into a true and false. Dementia is always caused by Alzheimer's disease. The answer is false. Dementia can be caused by a host of things. Vascular dementia, Lewy body dementia, even a condition such as HIV. You just need to know that yes, predominantly when you're working with older adults, you will see dementia caused by Alzheimer's, but there are other causes. But once you are working with someone with dementia, you can take lots of training. One that I'm very familiar with is called the gentle persuasive approach, and it allows you to learn how to work with patients with dementia. So when you get your job or you're in a role, they might ask you to take this training. It's an excellent training. It's very beneficial, but it teaches you how to approach someone with dementia. What are the things you say? Because certain things we say might trigger something and make them maybe responsive. And by that, I mean they may attack you. So it's very important for you to know how to deal with somebody with dementia. Next question. You're working a day shift and become angry at your coworker. Instead of responding appropriately, you go home and you yell at your family member. Which defense mechanism are you exhibiting? A, denial. B, conversion. C, displacement. D, compensation. The correct answer is C, displacement. So let's define these terms to make you understand this a little bit further. Displacement is when you transfer a negative emotion to a less threatening target. So this happens in many cases such as domestic violence, for example, guys, where a husband might have an issue at work and go home and hit his wife. Or a parent might have an issue with someone and go home and hit their child. It's always a weaker target where they can take out that anger or their frustrations or their feelings. That is called displacement. Denial is just failing to acknowledge reality whatsoever. If you remember in palliative care, when we learn about Kubler-Ross's stages of grief, the first time they tell someone you have a terminal illness, the person might deny it. And what this means is they'll say, no, not me. Nope, not me, not me, not me. So denial is where you just fail to acknowledge something that is real, something that is happening. Conversion is when you convert any tension and anxiety and it becomes physical. What does this mean? Maybe I'm stressed out. I'm going through so many things. So as a result, this repressed feeling I'm dealing with makes me end up having a rash all over my body. Or maybe I have a cough. I become ill. So this is pretty much me not wanting to deal with these feelings, but they're going to manifest into an illness. And lastly, compensation is a type of defense mechanism where you over-exaggerate. This is, I'm so busy all the time. Oh, I eat so many healthy meals. I'm the healthiest person ever. This is a way for you to make up for perceived weaknesses. Maybe you feel weak in another area, so you will pick something that you have a lot of control over, and you're trying to compensate for the weakness in the other area. Next question. According to Maslow's hierarchy of needs, food and water are A, safety and security needs, B, physiological needs, C, self-esteem needs, D, self-actualization needs. The correct answer is B, physiological. If you remember Maslow's, it's a great thing, but if you don't, I would recommend that you go into Google, look at the images, and look at that pyramid and try to understand it. What's at the bottom is what's needed before what's at the top. So, food and water are the first thing you see, and these are the part of the physiological needs, and you need this to maintain life. If I don't eat and if I don't drink my water, I can guarantee you that I will not be here. It's just a part of living. The next stage after this is safety. This includes security, health, finances. So what happens is if you do not meet the need from before, you cannot meet the next need. What this means is if I don't have food and water, I'm not going to care about my security, health, and my finances. The next step is love and belonging. This is friendship, intimacy, family connections. After that, the next layer is esteem. Respect, status, recognition, strength, self-esteem. The final layer, which is at the very top, which a lot of people don't reach, is self-actualization. This means I feel I've met my potential in life. When I was a kid, I wanted to be this, and I've met it. And I have the security, I have my friends here, I have my loved ones here, I have my food and water, I have my safety, I have my security, I have my health, I have my finances, I have made it. So the reason why a lot of people don't make it is because a lot of people are still trying to find a way to get to that level where they can feel satisfied with life. But you need to understand what Maslow is about, and you need to understand the layers and why they're important. But for this particular question, food and water fall in physiological needs. Okay. Next question. The prolonged retention and accumulation of feces in the rectum is called A, constipation, B, fecal impaction, C, diarrhea, D, anal incontinence. So this question might confuse people. They might get a little bit mixed up with A or B. But the correct answer is B, fecal impaction. Fecal impaction is a bowel condition in which there's a hard, dry mass of stool and it gets stuck in the colon or rectum. Constipation, however, is when the bowel movements become less frequent. For example, let's say I use the washroom every day and I have a bowel movement every day. Now I'm having it 3 times a week, and now it goes down to even 1 time a week. That's an example of constipation. It's becoming less frequent. But because I know I was going every day, I'll probably strain and try to do stuff to kind of go. And that's that difficult or incomplete passage that they're talking about. Diarrhea, as you know, is when it just literally comes out. Could be based on the food you ate, could be based off an infection. So many reasons for diarrhea, but it's increased motility, increased bowel movements. And because it's so fast, the stool doesn't have time to form, so it's typically loose, watery, or liquid. And to be incontinent just means that you cannot hold yourself to go to the washroom on time, so you no longer have the ability to control it. And if someone has anal incontinence, as you're working with them, you will typically know that they either wear a brief or pull-ups. And it's something that you can also do to help them by maybe putting them on a toileting schedule. Maybe every 2 hours give reminders and just make them go sit so that this can decrease the anal incontinence as well. Which of the following is not a sign of infection? A, fever, nausea, vomiting, rash, and or sores. B, pain or tenderness, redness, and or swelling. C, fatigue, loss of appetite, and or a change in behavior. And D, bleeding. The correct answer is D, bleeding. Signs and symptoms of an infection are very vast, and you need to understand them. But they also vary based on the location of the infection. So now we will talk about the signs and symptoms of infection. And these include things like a fever, feeling tired or fatigued, swollen lymph nodes in the neck, armpits or groin, a headache, nausea, vomiting, increase in pain, discomfort around the affected area, redness, swelling, warmth, fluid, or pus. If you remember, pus is also related to being purulent. A bad smell. A bad smell is one of the first signs that I would say, particularly if someone has like a urinary tract infection, you might smell that the pee's a bit off, and that's a sign of infection. Loss of appetite, confusion, rash, and or sores. Bleeding is not a sign of infection. Next question. Mr. Aditosin has Meniere's disease. Which is likely to be true? A, he has a middle ear infection. B, he has vision problems because of it. C, vertigo is a major symptom. D, hearing aids will correct the condition. So as I said before, guys, you always need to make sure that you pick the most right answer. Which of the answers is the top-notch answer? In this case, it's C. Vertigo is a major symptom. So Meniere's disease, if you recall from body systems, is a disorder of the inner ear that can lead to dizzy spells, also called vertigo, and hearing loss. In most cases, Meniere's disease affects only one ear. Meniere's disease can occur at any age, but it starts in young and middle-aged adulthood. Hearing aids cannot correct it. They help it. You need to understand that the hearing aid is not something that eliminates the problem. It just helps it. So that's why the question before when they said hearing aids will correct it, which was D, that's wrong. Hearing aids don't ever correct anybody who has hearing loss. Okay. Next question. What is the difference in the stool formation of an ileostomy versus colostomy? A, they're both in the colon, no difference. B, colostomies have more formed stools. C, only people with cancer get these. And D, the ileum is a part of the large intestine. The correct answer is B. If you remember, a colostomy is an opening in the colon. When we talk about prefixes and suffixes, it really will help you to really zone in to what the question is. So colo is taken from colon. That's the prefix. Ostomy is the suffix, which means opening. Ileo is taken from ileum, which is the prefix. Ostomy is the suffix. So colostomy means opening in the colon. Ileostomy means opening in the ileum. If you recall, the ileum is a part of the small intestine. The colon is a part of the large intestine. So, every time you eat, you need to understand that food travels, and with each time it moves, it deposits water. So food in the small intestine has not released as much water as food in the large intestine, because everything in the colon will eventually reach the rectum and allow whatever you have eaten to come out as feces. So, what this means is, whatever's in the colon is harder than whatever is in the ileum or the small intestine. So, a colostomy is an opening from the colon to the outside of the body through the abdominal wall. An ileostomy creates an opening from the ileum to the outside of the body, also through the abdominal wall. Stools and colostomies are more formed. It's important for you, if you are confused with this concept, to look at the anatomy of the small intestine and the large intestine. You will see that the small intestine comes before the large intestine, and you will also know that there's a lot of absorption of water as food travels in this particular canal, and this is a part of the digestive system. So by the time food reaches the colon, or by the time the excrement reaches the colon, there's been a lot of water absorption. That's why the stool is more formed. Okay. Next question. How can a PSW prevent regurgitation and aspiration in patients receiving tube feedings? Select all that apply. It's important for you to really understand the select all that apply questions and make sure you select all. So let's look at these. A, by checking the placement of the feeding tube. B, by positioning the patient in a sitting or semi-phallus position. C, by maintaining an upright sitting position for 1 to 2 hours after the feeding is complete. D, by allowing the patient to receive tube feedings while lying flat. And finally, E, by allowing the patient to drink sips of cold water every 2 hours. The correct answers are B and C. So, B was by positioning the patient in a sitting or semi-phallus position, and C was by maintaining an upright sitting position for 1 to 2 hours after the feeding is complete. So before I dig deep into this, I will discuss aspiration. We did mention it earlier, especially when we were talking about the unconscious patient who you have to lay on the side when you're doing oral care. But aspiration is when food, fluid, saliva, or foreign objects enter the lungs. To prevent this, a patient should sit upright when feeding, even tube feedings, and keep someone upright after feeding. So, let's look at the other options. A, by checking the placement of the feeding tube. This is not in your scope as a PSW. You do not check placement. This is in the nursing scope. D, by allowing the patient to receive tube feedings while laying flat. You need to recall and remember that you do not eat when you're laying flat. I mean, you could try, but you will definitely choke. That's the same principle we need to use for our patients, which is why we keep them upright. And E, by allowing the patient to drink sips of cold water every 2 hours. That doesn't really matter in terms of aspiration and regurgitation. Yes, it's good to give a client water, but is it relevant to this particular question? So the correct ones were B, position the patient in a sitting or semi-phallus position, or C, maintain an upright position after. So it's important to maintain an upright position after to ensure that everything goes down and that the digestive system works well. And another thing you need to understand is you need to understand what low phallus is, what semi-phallus is, and what high phallus is. But putting someone in a semi-phallus position allows them to be upright enough to ensure that no aspiration occurs. Okay, guys, so thank you. That was officially our last question. I'm hoping that this was very helpful to you. If you have any recommendations or any other input that you have, please comment below. Let me know. And if you have topics that are really difficult that you just don't understand, please let me know. I'll be very happy to do videos on those as well. My purpose is to just make sure that you pass your NACC exam, and I'm hoping that this video was helpful. So again, please like, share, subscribe, and I will see you next time. Have a wonderful, wonderful, wonderful time. Thank you.